This afternoon we are going to report about gastroesophageal reflux or the GERD. Objectives: to briefly review the definitions, natural history, and mechanisms of GERD and GERD. To discuss the diagnosis of GERD in infants and the warning signs suggesting other more worrisome disorders. And last is to discuss the management options for physiologic GERD and for GERD. So what is GERD? Gastroesophageal reflux happens when stomach contents come back up into the esophagus. GERD often causes regurgitation, stomach contents coming up through the esophagus and into the throat or mouth and spitting up. Vomiting is an example of regurgitation. It is because ang regurgitation muna siya to throw or pour back or out from. Regurgitation and spitting up are normal in infants, babies younger than 1 year old. And in GERD occurs in approximately 50% of infants under the age of 2 months, and then 60 to 70% of infants aged 3 to 4 months, and 5% of 1 year old. So as you can see, common siya sa infant yun kay ang GERD, kay ang baby ani, liquid diet pa man sila, so sige, magdede pa, breastfeed or sabana, and then they tend to sige na sila gigdaan yung time muna common yun siya mag-vomit or mag-spit. Gastroesophageal reflux is classified as follows: physiologic or functional gastroesophageal reflux. These patients have no underlying predisposing factors or conditions. Growth and development are normal, and pharmacologic treatment is typically not necessary. So gastroesophageal reflux is a normal physiologic process that occurs several times a day without symptoms or damage of the esophageal mucosa in most otherwise healthy individuals. So talaga, pharmacologic treatment is typically not necessary. So, ang GERD, okay lang gina siya, normal lang gina, and actually, magkuha na siya 2 to 3 times mahitabo ni sa infant. Magkuhaan, mag-vomit or spit up. And then, pathologic gastroesophageal reflux or gastroesophageal reflux disease, muna ang GERD, muna niya mong gi-focus karon. Patient frequently experience some complications requiring careful evaluation and treatment. Muna siya mong i-discuss. And then secondary gastroesophageal reflux. This refers to a case in which an underlying conditions may predispose to gastroesophageal reflux. Examples include asthma. It is a condition which may also be in part caused by exacerbated by worsen, and gastric outlet obstruction. Symptoms include sa secondary gastroesophageal reflux kay coughing, wheezing, or shortness of breath. So napilaing ngalan ang GERD. So, yeah, acid indigestion. Pwede na matawag po na siyang heartburn. And then ako ang acid reflux, acid regurgitation, reflux, and spitting up. So that. Some mechanisms, angle of his underdeveloped. Ako nang i-explain na po sa next slide kung asa ang angle of his. Okay. Sa angle of his, also known as esophagastric angle, it helps to prevent acid reflux of stomach acids into the esophagus. It is commonly undeveloped in infant, munang underdeveloped siya. And then inadequate gastric accommodation, supine position plus gravity, ma-result din siya sa gastroesophageal reflux. So di ba, pag nakahigda man din ang baby, so ang gikaon niya, mula hus rin sa baka. Kaya supposedly, nakasit up man din dapat ang bata pag magpatutoy ka or magpakaon. Kung di mong ipasok pa yung position plus gravity, result na dayon ang birth. So, pathophysiology. The angle of ease made by the esophagus and the axis of the stomach is obtuse in newborn but decreases as infants develop. This ensures a more effective barrier against gastroesophageal reflux. The presence of hiatal hernia, ako na dyan pong i-explain ano, kita naman siya. Wait lang, ako na din basahon sa. May displace the lower esophageal sphincter or the LES into the thoracic cavity, where the lower intrathoracic pressure may facilitate gastroesophageal reflux. However, the presence of the hiatal hernia by itself does not predict gastroesophageal reflux, which means that many patients who have a hiatal hernia do not have gastroesophageal reflux. Resistance to gastric outflow rises intragastric pressure that leads to reflux and vomiting. Examples include gastroparesis. Kaning gastroparesis, ang pagkaon bitaw, supposed to be mudagan mo din ang pagkaon malaw sa stomach, nag-stop siya sa esophagus. So muna siya ma-resolve sa gastroparesis, mag-stop and slow ang dagan sa inyong food. Dito siya nagpunto sa esophagus, di siya kalos sa stomach. And then gastric outlet obstruction and pyloric stenosis. So kaning hiatal hernia, so muni ang esophagus. Then muni ang angle of is karita great curvature bitaw sa esophagus ug sa stomach. Muni siya ang mag-prevent pud siya sa acid nga mo balik do. Pero so diri ang esophagus and diri diaphragm. Apa na? So, kari na lang. So, muna yung diaphragm. Then, diri ang esophagus. Katong mahita ko ang hiatal hernia, mag-obstruct di siya. So, muna ito, ano sa to? Buburot. Kasi ano ito yung ano? Bulge. Sorry, bulge. Siguro sa siya diri mo din ang result of hiatal hernia. And then kaning lower esophageal sphincter, kita mo ani, mo close na siya. Then mo open. Once mag-introduce ang food diri mo, dali siya sa imong esophagus, mulago sa imong stomach, mo close na dahil siya, i-close mo na siya. So, once nasulod na ang food sa imong stomach, mo close na dahil siya. Pero kung ang pagkaon magbalik-balik, bahala ginagmay, pero frequent dito siya sige, ana-ana, gana din ma-resolve ang birth. Diba? Girl, mato kanina na siya D. Isis na dahil na siya. Mara rin siya na luang na dahil dito.
Manay ka.
Apay ra?
Yes.
Okay, apay ra. Hindi naman dahil ito. Ang muli ka sa upper pa. Sa upper GI pa tayo.
That is esophageal sphincter.
Ang lower esophageal sphincter, muna siya ang urban, o diba, allowing acid reflux.
Ano ba yan?
Balik-balik, pero pag once sunod na introduce ka din food, close na rin po siya. Aron, mag-prevent for acid, nga mula ko sa mga esophagus, di ba, pag mag-cram-cram, lahi na rin, oh, yan. Makapa din yung acid sa inyong pamati. Kumuna siya. So causes, when we eat, food passes from the throat to the stomach through the esophagus. A ring of muscle fiber in the lower esophagus prevents swallowed food from moving back. So a ring of muscle, muna to, muna rin siya. Kaning lower, kaning LES less. Muna siya ring of muscle. When this ring of muscle does not close all the way, stomach contents can leak back into the esophagus. This is called reflux or gastroesophageal reflux. Pero pag mag-leak dito siya balik-balik, like magbalik-balik dito na matawag siya. Nana siya D, kaya ma-disease na dahil ang GERD. In infants, this ring of muscles has not fully developed and this can cause reflux. This is why babies often speed up after feeding. Reflux in infants goes away once this muscle develops, often by age 1 year. Kaya kaning time pag imo bito silang magtutoy na sila mag-feeding, maglingkod naman ni sila. So kaning mga infant, kung ano sila, tend to lie down or sila all the time. So when symptoms continue or become worse, it may be a sign of GERD. So risk factors. When symptoms continue or become worse, it may be a sign of GERD. Certain factors can lead to GERD in children, including katong hiatal hernia kay birth defect siya. So occurs when a part of stomach protrudes up into the chest to the sheath of muscle called diaphragm. So it impairs the esophagogastric junction. Obesity. So sa obesity may increase intra-abdominal pressure, impair gastric emptying, decrease lower esophageal sphincter pressure, and possibly increase transient lower esophageal sphincter relaxation, all of which could lead to increased esophageal pressure. Certain medicines such as some medicines used for asthma. So sa meds for asthma may increase po siya intrathoracic pressure and decrease lower esophageal sphincter pressure. Ang second hand smoke kay makalid po ni siya over the surgery of the upper abdomen can cause increase in intra-abdominal pressure and may lead to an increase in GERD. So brain disorders such as cerebral palsy.
Sa brain.
Cerebral palsy.
Sa brain man na tanaw.
Sakit na siya sa brain. Then, nung muscle bitaw kay mag-stiff. Siya involuntary.
Cerebral palsy.
Mag-stiff siyang mga muscles. So many patients with cerebral palsy are in chronic supine position. So, og mag-supine position ka kay kuan man na, pwede man mo sakay mong gastric juices kung ano mag-supine ka. So, dapat kung nakay GERD, magkuhan dapat elevated. Kung magtigda ka, elevated yung
Likod. Mag-elevate ang pagigda.
have scoliosis that replaces the stomach and stress chest the lower esophageal sphincter, and have increased intra-abdominal pressure from spasticity. Genetics. One's gene can play a role in causing structural problems, the esophagus, which in turn causes GERD. The signs and symptoms of reflux and GERD in infants. In babies, the main symptoms of reflux and GERD is spitting up. GERD may also cause symptoms such as arching of the back, often during or right after eating. Colic or kuan siya. Kanang colic kay when a healthy baby cries for a very long time for no obvious reasons. Crying that lasts for more than 3 hours a day with no medical cause. Gagging or trouble swallowing, irritability, especially after eating, poor eating or refusing to eat, poor weight gain or weight loss, wheezing or trouble breathing, forceful or frequent vomiting, spits up green or yellow fluid, consistently spit up forcefully, causing stomach contents to shoot out of the mouth. This is called projectile vomiting. Has difficult breathing or a cough that won't go away.
Clinical features that distinguish gastroesophageal reflux from GERD in infants and children. So we have for body systems, we have the vital signs and growth parameters. So sa gastroesophageal reflux pictures, normal pa iyang weight gain. So pagkapot sa disease, na siya disease, ma-poor na iyang weight gain or weight loss and failure to thrive. So, yung signs and symptoms kay fever and failure to thrive or kanang maglisod bitaw siya og gain of weight o dilipod kayo matubo ang baby. So, next sa body system kay gastrointestinal. So, sa girl, na siya little difficulty with feeding. Naku siya symptoms are not bothersome to the infant or child. So, inigna na siya girl, feeding refusal or prolonged feedings, postprandial irritability in infants, dysphagia or odynophagia, recurrent vomiting, heartburn in children, chest pain, epigastric pain, non-localized abdominal pain, regurgitation, and vomiting beyond 18 months of age. So, yung signs and symptoms sa gastrointestinal kay bilious vomiting or kanang mag-vomit ang baby kay ang color sa iyang suka kay yellowish green bitaw siya murag ang acid nga nasa iyang kuan nalain na siya color. So persistent or forceful vomiting, onset of vomiting after 6 months age, gastrointestinal bleeding, persistent diarrhea or constipation, abdominal tenderness or distension, or hepatosplenomegaly. So, kaning hepatosplenomegaly kay ang both liver and spleen kay enlarged. Next kay respiratory. Sa GERD kay no significant symptoms. Pag-abot sa GERD, na siya chronic cough, wheezing, or hoarseness. Tapos siya asthma, recurrent laryngitis, pneumonia, sinusitis or otitis media, apnea or cyanosis. Yung signs and symptoms kay apnea or cyanosis or lack of oxygen in blood. Next is nervous system. So, sa GERD na siya no neurobehavioral symptoms. Pag-abot sa GERD, na siya Sandy-Fire syndrome or neck tilting in infants. So, yung signs and symptoms kay Sandy-Fire syndrome, lethargy, bulging fontanelle, micro or macrocephaly. Ang macrocephaly kay muna siya katong gamay og head ang baby bitaw dayon dili siya
Macro?
mo match sa body niya.
Macro?
Micro.
Macro. Macro may dako, di ba?
Next is seizure.
Micro may gamay.
Developmental delay or other disorders. So next is warning signals in vomiting infant requiring further investigation. So, mo to siya bilious or continuous vomiting, GI bleeding, onset of vomiting after 6 months of life, failure to thrive, diarrhea, constipation, fever, lethargy, hepatosplenomegaly, macro or microcephaly, bulging fontanelle. Mo na siya ang kanang naay fluid iya ang head bitaw. Dayon, mo-trigger siya sa iyang skull mo nang hubag iya ang head. Seizure, abdominal tenderness, distension. Kini siya kay kanang mura bitog kabuhi mo na siya. Abdominal tenderness. So documented or suspected with genetic or metabolic symptoms.
Kaya nakita naman po sa video. Kaya ang X-ray. Diagnostic test. X-ray of the baby.
Diagnostic test. In most cases, a doctor diagnosed reflux by reviewing your baby's symptoms and medical history. If the symptoms do not get better with clinic changes and anti-reflux medicines, your baby may need testing. Several tests can help a doctor diagnose GERD. Sometimes a doctor orders more than one test to get a diagnosis. Common tests include upper GI series. Kaning upper GI series, kani siya X-ray. which looks at the shape of your baby's upper GI or gastrointestinal tract, your baby will drink or eat a contrast liquid called barium. The barium is mixed into a bottle or other food. The healthcare professional will take several x-rays of your baby to track the barium as it goes through the esophagus and stomach. Muna na mention ang barium, matawag na rin siya barium swallow. Basta paano niya siya, pwede siya nga test para ma-detect kung na may problem sa imong GI. Include na gra, esophagus, stomach, duodenum. Then, kani nga nakita, tagay na siya dahil panaog. Basta ma-detect, pwede kani siyang test, ma-detect mamulay kung ay problema sa imong GI. And then naman esophageal pH and impedance monitoring, which measures the amount of acid or liquid in your baby's esophagus. A doctor or nurse places a thin, flexible tube through your baby's nose into the stomach. The end of the tube in the esophagus measures when and how much acid comes up into the esophagus. The other end of the tube attaches to a monitor that records the measurements. Your baby will wear this for 24 hours. Pero pag nara sa hospital, matawag na din siya esophageal 24 hours pH and impedance monitoring. And then, napod ang upper gastrointestinal or GI endoscopy and biopsy. May na siya ang pinaka-common pag naay mga reflux or GERD ang infant nga test gamiton. Pwede po itong barium swallow kay katumoy invasive man siya na test kay x-ray, which uses an endoscope, a long flexible tube with a light and camera at the end of it. The doctor runs the endoscope down your baby's esophagus, stomach, and the first part of the small intestines. Muna siyang sulod sa imong gastrointestinal. While looking at the pictures from the endoscope, the doctor may also take tissue samples muna na ang biopsy. And then last, ang scintigraphy. Ang scintigraphy test, this is a procedure that pictures or scans. Lahi ang CT scans, lahi po ni siya of structures inside the body. So, nato siya yung mga advantage. Detects acidic and then acidic GERD. Evaluates gastric emptying. Muna to ang gastroparesis. May demonstrate aspiration. Pero na po siya limitations, lack of standardized techniques, absence of age-specific normative data, and last, period of observation, limited to early postprandial period. Basta ang postprandial, after meal na siya. Nursing diagnosis. Imbalance of nutrition, less than body requirements related to inability to intake food because of reflux. So, kaning kwan, ang GERD man kay, diba, dali ka siya ma-irritate lang iyan after eating. So, nursing intervention.
Di ba nag-mention sila about cyanosis mo?
Encourage small frequent meals of high
Cyanosis, so
calories
lack
and
of
high
oxygen man dapat nag-decrease
Instructor
cardiac
remain
output
in
man
upright
ba sila?
position at least 2 hours
Imbalance
after
ang
meals.
Balance.
Avoiding eating
Diba?
3 hours before
Kay
bedtime.
cyanosis ng cyanosis
Instructing them
man.
to eat slowly and masticate foods well. Encourage small frequent meals
Pwede naman
of
siguro.
high calories and high nutrient foods.
Kasi nakatake ko sa
Risk for aspiration related to esophageal compromise affecting the lower esophageal sphincter. So, nursing intervention. Avoid placing the patient in supine position. Have the patient sit upright after meals. Instruct the significant other of the patient to avoid highly seasoned food, acidic juices, bedtime snacks, and foods in high fat. So, kaning instruct the significant other kay diba sa India man ta. So, bata pa jud ni, so instruct nimo ang significant other sa patient. So, elevate HOB while in bed. Kaning HOB kay head on bed. So, elevate
head.
Then, acute pain related to irritation gastroesophageal mucosa. Nursing intervention. Assess for heartburn. Carefully assess pain locations and research pain from GERD and angina pectoris. So, yung treatment kay lifestyle and dietary changes. So, kaning lifestyle and dietary changes kay bata man siya kanang bata pa man siya, so i-instruct lang nato iya ang parents or may bantay na if obese siya na mag-exercise anak ra.
Ang baby?
Dili pud ka ng mga 5 above bitaw edad children.
Kailangan nila sa exercise.
Next is pharmacologic therapies. So kining pharmacologic therapies kay if ever na ay giresita tambal ang doktor, kay kuno na siya i-take siya kay naman ko'y possibility nga ang lower esophageal sphincter kay mahubag siya or makanserous po itong, sige makabalik ang acid, so murag na ay malubog itong acid bitaw sa iyang esophagus. So ano siya? Surgical therapy.
Sample daw. The pharmacologic therapy.
Kanya ra, wait lang ha. Basta lang. Lifestyle and dietary changes. So, for older children, kanang mga 5 or 5 above, anak, avoid alcohol kay pwede manggod nga ma-influensyahan siya sa iyang pwede po nga napasuhid siya sa awat-awat ba. So, lose weight if obese. Positioning changes. Kaning positioning changes kay inigumagkaon kay malingkod, higda, po na siya yung cause of acid reflux. So, next is cessation of smoking. Kanang mga second-hand smoke, bitaw, mga siya. Avoid large meals. Avoid chocolate, caffeine, and spicy food. So, for infants, normalize feeding volume and frequency. So, ang infants, kay mag-breastfeeding na sila, di ba? So, ano siya, mag-range din na siya 2 to 4 hours ang breastfeeding time. Hindi na siya pwede mo increase kay basin madulay. Saka magdulay. So, next is consider thickened formula. Muna siya ang kanang pakanan siya o kanang mga cereal lang. Kanang ito, mga na siya. Mga dili ra pud kay siya liquid ba. Next is positioning, trial of hypoallergenic formula. Kaning trial of hypoallergenic formula kay mo ni siya katong mga soy milk, mga fresh milk na bitaw hypoallergenic. Next is keep things loose around the waist. So, og naman gali siya mga habak na dili na siya pwede kay dapat kuaon na siya kay ma-trigger man niya ang esophagus. So, mo siya maka-cause po.
Amo ding kanang sa ubi kay kuan o ingnon ta ay naihabak ma'am ganana sila.
Dapat na siya kuaon maka-trigger man siya. So, next is management.
So, binas na mag-short. Ang bata na.
Ay, dili.
Pwede ra.
If dili hugot bitaw walay garter na.
Loosen lang ako nga sure.
Garteran. So, management, conservative therapy and lifestyle modification form the foundation of GERD therapy. Dietary measures of infants include normalization of any abnormal feeding techniques, volumes and frequencies, thickening of feeds or use of commercially
Ay di man day
thickened
mag-carcha
formula
kay
increases the
sa abdomen man day
percentage
na
of
no.
infants with no regurgitation, decreases the frequency of daily regurgitation and emesis, and increases the infant's weight gain. The evidence does not clearly favor one type of taker over another. The addition of a tablespoon of rice, cereal per ounce of formula results in a greater caloric density and reduced crying time, although it might not modify the number of non-regurgitated
gurgitant reflux episode. Next is a short trial of hypoallergenic diet may be used to exclude milk or soy protein allergy before pharmacotherapy. So dapat kabalo ta og naa ba siya allergy sa mga milk before ta mag-prescribe og alcohol. Next is a short trial of a hypoallergenic diet may be used to exclude milk or soy protein allergy before. Next is older children should be counseled to avoid acidic or reflux. Inducing foods
Katulo na.
like tomatoes, chocolate, mint, and beverages. Weight reduction for obese patients and elimination of smoke exposure are other crucial measures of all ages. Another is positioning measures are particularly important for infants who cannot control their positions independently. Next, seated position worsens infant reflux and should be avoided in infants with GERD. Esophageal pH monitoring demonstrates more reflux episodes
Check
in
ang-
infants in supine and side positions compared with prone position, but evidence that the supine position reduces the risk of sudden infant death syndrome has led the American Academy. So next is when the infant is awake and observed, prone position and upright carried position can be used to minimize reflux. So, the efficacy of positioning for older children is unclear, but some evidence suggests a benefit to left side position and head elevation during sleep.
Yes.
So,
Wala
for
po, ma'am.
pediatric patient, important na mag-position siya sa left recumbent ba ng anak? Left recumbent position kay para dili mabalik ang acid sa esophagus. So, right man good kay naman dili dapat ang esophagus, di ba? So, har siya mabalik. The head should be elevated by elevating the head of the bed rather than using excess pillows to avoid abdominal flexion and compression that might resist reflux. Next is pharmacologic therapy. Pharmacologic therapy, diha ang antidotes and other agents, prokinetic therapy, na ang cisapride, domperidone, metoclopramide, betanicol, erythromycin, and baclofen. And then now po ang H2-RAS or the
Magtiwas silang PPT ata, ma'am? Yes.
Wait lang. Ayan. Ang H2-RAS kay histamine 2 or antagonist.
Didugo man ata siya.
Lizatadine and
Dysmenorrhea siya, ma'am.
famotidine. The management sa antacids. Antacids are the most commonly used anti-reflux therapy and are readily available over the counter. They provide rapid but transient relief of symptoms by acid neutralization.
Ma'am,
The long-term
wala.
regular use of antacids cannot be recommended because of side effects of diarrhea or magnesium antacids and constipation, and rare reports of more serious side effects at chronic use. Dapat ang prokinetics agent include metoclopramide na ang dopamine 2 and 5-HT antagonist, betanicol, muna siya ang cholinergic agonist, and erythromycin, motilin receptor agonist. Most of this increases less or lower esophageal sphincter pressure. Some improve gastric emptying or esophageal clearance. None affects the frequency of ang transient to lower esophageal sphincter reflux. And then sa histamine 2R antagonist include cimetidine, famotidine, nizatidine, and
John, asa
ranitidine
si Charmaine?
are widely used anti-secretory agents that act by selective inhibition of histamine receptor of gastric parietal cells. Basta muna sila ang mga para dito sa gastric acid secretion. Then there is a definite benefit of histamine 2R antagonist in treatment of mild to moderate reflux esophagitis. Histamine 2 or antagonists have been recommended as the first-line therapy because of their excellent overall safety profile, but they are being superseded by PPIs. PPI na proton pump inhibitor, next slide na ko na-explain, in this room has increased experience with pediatric use and safety. U.S. Food and Drug Administration approval and pediatric formulations and dosing are acquired. Na ang proton pump inhibitors, na dali ang omeprazole, lansoprazole,
Cut.
pantoprazole, rabeprazole, and esomeprazole.
Laylay no
Provide the
to.
most potent anti-reflux effect by blocking the
Okay, okay.
hydrogen potassium
Kira dyan.
adenosine phosphate channels of the
Hapit naman
final
po na.
common pathway
Hapit
to
na na.
gastric acid secretion. PPIs are superior to histamine 2R antagonists in the treatment of severe and erosive esophagitis. Pharmacodynamic studies have indicated that children require higher doses of proton pump inhibitors than adults on per weight basis. By this age, related changes are due to changes in the body composition and then especially the extracellular and the total body water spaces and plasma protein binding. Then the use of PPIs to treat infants and children deemed to have birth on the basis of symptoms has considerably increased in recent years. Controlled trials in infants with birth diagnosed on the basis of symptoms alone have suggested an efficacy similar to placebo and have raised a safety concern. So naabot tayo kuan. Surgery.
Amoy na.
So surgery, usually fundoplication, is effective therapy for intractable GERD in children. Particularly those with refractory esophagitis or strictures and those at risk for significant morbidity for chronic pulmonary disease. It may be combined with a gastrostomy for feeding or ventilation. So kani Nissen of door, paano siya para strengthen sa lower esophageal sphincter kay ganina, nag-open naman ko siya, pero there is isang
Tahi. Itahi nila.
Itahi nila para ganito ma-close. Oh, then galing 2K, kaya paano siya, surgical treatment siya sa hiatal hernia. Oh, surgical treatment siya sa hiatal hernia. Then, a little reminder, feeding changes may help your baby's reflux and GERD. Add rice cereal to your baby's bottle of formula or breast milk. Check with the doctor about how much to add. If the mixture is too thick, you can change the nipple size or cut a little egg in the nipple to make the opening larger. Burp your baby after every 1 to 2 ounces of formula. If you breastfeed, burp your baby after nursing from each breast. Avoid overfeeding. Give your baby the amount of formula or breast milk recommended. Hold your baby upright for 30 minutes after feeding. If you use formula and your doctor thinks that your baby may be sensitive to milk protein, your doctor may suggest switching to a different type of formula. Do not change formulas without talking to the doctor. So, dili ta magbuot-buot o change the formula kung wala ingon sa doctor. So, another information, wait lang. Ang birth usually begins at approximately 2 to 3 weeks of life. So, da mag-spit and vomit ang bata pag 2 to 3 weeks and peaks between 4 to 5 months. Most babies who have born at full
So,
term will
ang
have
gear,
resolution of
normal.
symptoms by the time they are
Reflux
9 to
na
12
siya, pero kung
months
ma-severe
old.
na yung
In
symptoms,
most babies,
this is
GERD disappears
Geared na
as the
dayon.
upper digestive tract functionally matures. So in addition, normal development including improved head control and being able to sit up, as well as introduction of solid food, will help to improve GERD symptoms. GERD in infant is not considered a disease. Basta mudugan na kay ang D, which is GERD, komplikado na to, and does not include a D. In fact, GERD is considered normal. These infants are known as happy speakers because they are not cranky and do not appear to be in a great deal of pain when speaking up. In fact, your baby may feel better after a good speak up. Other symptoms of GERD include mild feeding problems such as occasional prolonged feeds or interrupted feeds. So, muto siya. Muto ang GERD.
I-end na ako ha.